Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to speak with you about the common urologic condition called hematuria. In this brief video, I'm going to define the problem, discuss some of the common risk factors associated with hematuria, and then review the evaluation for this common urologic condition. Let's begin with the definition of hematuria. Hematuria means blood within the urinary tract. There are two types of hematuria. Microhematuria is the blood in the urine that you cannot see, but is only identified after looking at the urine underneath the microscope. Gross hematuria is the hematuria, or blood in the urine, that is visible when you go to the restroom. Hematuria indicates that blood is coming from somewhere in the urinary tract, anywhere from the kidneys, the tubes connecting the kidneys to the bladder or ureter, the bladder, or the prostate, or the urethra, the tube that allows urine to exit the bladder to go outside of the body. Hematuria occurs in approximately 5 to 10% of the population. The cause of hematuria can usually be found after an evaluation. The chances of having cancer associated with hematuria is very low, especially those under the age of 40. However, those who have hematuria who are more than 40 years of age, the incidence of having cancer is approximately 10%. The causes of hematuria can be anything from benign conditions associated with excessive exercise, high-impact exercises, or running. It can be due to cysts anywhere in the urinary tract or urinary tract infections. Enlargement of the prostate gland, especially in men over the age of 50, is a common cause of hematuria. Polyps, stones, dilated blood vessels, tumors of the kidney, the bladder, and the prostate gland are other causes of hematuria. There are risk factors associated with hematuria. Examples include high blood pressure, smoking, exposure to chemicals and dyes, urinary symptoms, or use of certain medications such as Cytoxan, phenacetin, and finally radiation exposure can also result in the side effect of hematuria. So who should be evaluated for the problem of hematuria? Especially all men and women over the age of 40 should undergo a thorough evaluation if blood is found in the urine. Now, what is the evaluation? The evaluation consists of a history, particularly asking questions about urinary symptoms such as painful urination, frequency of urination, or getting up at night to urinate. We will also review any medical conditions you have, such as high blood pressure, and ask about any medications you may be taking. Social history, particularly asking about the history of smoking, is also very important, as well as your family history, if there's a history of hematuria or urologic conditions within the family. The physical exam, it consists of determining the blood pressure, taking a general examination, particularly examining the abdomen, a pelvic examination in women, and a digital rectal exam in men to evaluate the prostate gland. The lab tests are a urine examination, possibly a urine sent for a culture to see if there is any evidence of infection. A 24-hour urine collection may be required if there is a suggestion of kidney stones. Tumor markers and blood tests are also performed. The radiologic examination consists of either a renal ultrasound or a CT scan of the abdomen and pelvis, both of which are done at a radiology facility. You will also undergo a cystoscopy, which consists of the insertion of a small lighted tube passed through the urethra into the bladder to look at the interior of the bladder and at the prostate gland in men. Now, what if nothing is found after the thorough evaluation? Well, it may be due to a benign condition such as runner's hematuria. If the infection may have cleared, you may have passed a small stone. There may be weak blood vessels on the surface of the bladder or the prostate gland. It may be a renal cyst, and also in a small number of cases, we may never know the cause of the hematuria. So in summary, hematuria, or blood in the urine, requires a thorough evaluation consisting of a history, a physical exam, a few laboratory tests, a radiographic examination, and a cystoscopy. Hematuria is a very important sign and should be taken seriously. I know you may have some additional questions regarding hematuria, and I would like to suggest that you go to my website at www.neilbaum.com for further information and examples of what you should do if you have this common urologic condition. Thank you.